So we have mood disorders, we have anxiety disorders, obsessive compulsive disorder being at an extreme end of the spectrum, generalized anxiety disorder, social anxiety disorder, health anxiety. So we have the mood disorders, we have the anxiety disorders, trauma, and ADHD. So those are kind of my 4 niche expertise.
That's interesting. You know, I would have thought ADHD was under anxiety. It seems like it is, but I guess technically it's not.
And there's total overlap between them. We can talk about that.
We'll get to that, yeah.
And then just to finish the point, so self-esteem, I mean, that's not one of these categories, but self-esteem in general, I mean, that building healthy self-esteem is also one of kind of my passions. And something that I've studied and something I work on every single day with patients.
In my opinion, that's one of the things you're best at, building healthy self-esteem in yourself and in your friends, family, the people around you. You've always been particularly good out of all my friends I've known at self-esteem, building healthy self-esteem. And one of the things that I've noticed is that self-esteem is not a selfish act.
No.
Right? You're not just building your own self-esteem at my expense. You raise me up and grow your own self-esteem as a result. Yeah.
And I thank you for that compliment. And I will say, I've been working on it my entire life, not just, well, in a systematic way. I mean, studying the greats, Nathaniel Branden, who I consider to be the father of self-esteem, but treating it as a science of its own, breaking it down. I don't know if you want me to go into a little bit of a spiel about self-esteem.
Absolutely. Yeah. No, let's talk about it because I think it's super interesting. It's something that everybody can do. Everybody can work on. It's a foundation for you to build your life off of outside of whatever other ailments you may have. And it's rewarding when you start seeing results from working on it. So I feel like it's very motivating, you know, to any particular person who's working on their self-esteem. It's just that you have to be conscious of what exactly is self-esteem and how do you build it.
Absolutely.
And like being mindful about your own self-esteem. Oh, if I really want to, you know, do this certain action that's going to diminish my own self-respect or diminish the gains I've made towards my own self-control. And I'm just going to break this for a day. And I know it's wrong. And I know it's going to have a negative impact on my mental health, but I really want to do it. So I'm just going to do it. And it's like, you know, you're not giving enough weight to the importance of really sticking with your principles that maybe that you've defined yourself.
Bingo.
That build up your own self-esteem and like really just recognizing that, no, it's important. The self-esteem thing is important. And I should stick to it and continue to grow and not let these whims dictate what I'm doing.
Yes. And I should pass a compliment back to Jeff. Now, me and Jeff, I mean, we're somewhat birds of a feather. We've grown up together since we were 5 years old. We've both had a distinct interest in this, and I can't count how many conversations we've had about self-esteem.
Yeah.
So, I mean, I would agree with literally everything you said. Now, how important and how crucial and vital is having healthy self-esteem? I think it'll become more clear once we define it. So, I mean, if you're watching at home, I'm going to ask you a question. I want you to pause it after I ask you and just kind of give an answer before you resume it.
Yeah. And by the way, leave your answer in the comments.
Leave your answer in the comments. What is your definition of self-esteem? What does that mean? I mean, we throw that word around all the time, but what is your definition of self-esteem?
Yeah. And it can't just be simply feeling good about yourself. It's too vague. It's too broad, right? Specific things you can take action on.
Yes. Now, I'm going to come back to that word action. So, okay, let's assume everyone just resumed. So self-esteem. Now, I subscribe to Nathaniel Branden's definition.
6 pillars, right?
6 pillars of self-esteem, if anybody wants to read that. Now, self-esteem is divided into 2 main branches. One, self-efficacy, meaning given some task, I feel like I am able to learn the steps necessary to accomplish that task successfully. That's one arm out of 2. Second arm, self-respect. I feel like I am worthy of having a good life and good things happening to me. So what is the overarching definition is I feel like I'm worth a good life and that I am capable of handling life's challenges. Now, is there anything more important to that for like literally everything? I mean, mood, anxiety, I mean, just being a human being, relating to others. Now,
Probably not. And those aren't easy. Let's be clear about this. To actually, to truthfully on a deep level, feel like you can attack life's challenges properly and you rise to the occasion is not an easy task. Everybody, when they start any venture in life, will immediately learn that it's a lot harder than you thought it was going to be. You're probably going to fail at a few different things, right? That's normal.
Unquestionably.
And you work on building up the real world skills to allow yourself to perform as well as you would hope you would. As you thought you would when you started this venture, you know.
Absolutely. And let me kind of pick you up on a couple things you said. Now, if you guys want more on self-esteem, you can let us know in the comments. I mean, we could talk 2 hours just about that. But a couple things that Jeff said. So, one, it's not enough to just learn about self-esteem. There's a call to action. Now, I have patients come to me all the time like, Doc, I'm working on this in therapy. I'm like, yeah, but what actions, how has your behavior changed? A lot of them can't give me an answer. So it's not enough to learn. You need to act. Chapter 2 in his book is called A Call to Action, right? Another thing you said, right? Integrity. Having your behavior being congruent with your values, like what you were saying. So if we talk about the actions that help build healthy self-esteem, having your behavior being congruent with your values is incredibly important. So what's like one example, easy example? Let's say you really, really value loyalty and fidelity to your spouse, right? Now, let's say you've been engaging in like some sort of infidelity with your spouse, whether you're flirtatious with some woman at work, whether whatever.
Yeah, so it doesn't even necessarily have to be actually cheating on your spouse. It could be entertaining a little bit of flirty conversation with a coworker, and if that disrupts your morals, that counts. That counts to you because you care about that.
All that matters is that it counts to you and your values. Now, every time your behavior is incongruent with your values, your self-respect is going to suffer. Would you want to be friends with someone that is behaving like you, right? Now, people ask me all the time, like, Dr. Mike, do you judge your patients in the session? And I give them an answer. I'm like, listen, I will sometimes judge them based on their own values, right? We align their compass.
Yeah.
And if they're acting incongruent with their own stated values, goddamn right we do.
They need to know that.
Yeah.
Maybe they don't notice they're doing it. They need to know.
Yeah. Now call me. I mean, are there other providers and psychiatrists and psychologists that will never pass judgment? Yeah.